Physician-assisted suicide is when a physician gives a terminally ill patient a lethal dose of medication in order to end their life. A Harris poll of January 2002 found that 65% of respondents support the legalization of the right to physician-assisted dying. This poll shows about how many people in the United States want the choice to end their life with the help of a physician if they become terminally ill or in so much pain they just can't take it anymore. People want it to be available so that they can die on their own terms with their dignity still intact and without being a bother to their loved ones. They don't want their loved ones to watch them suffer through a slow, painful death. Physician-assisted suicide should be legalized. The most important thing about legalizing physician-assisted suicide is the emotional aspect of it. The patients are suffering and want to be able to die with dignity. Some illnesses cause the patients to lose so much control that others have to do daily tasks because they are in too much pain to do it themselves. They don't want to live like that, but they have to because it is not legal. Some people are in so much pain that they take matters into their own hands. One woman describes what she went through with her daughter who had bone cancer. She was in a lot of pain and wanted to end it, but she didn't want her mom to get in trouble. In the end, her mother assisted her daughter in dying by giving her medication. She said that she was finally able to hug her daughter without hurting her. In another case is that a man diagnosed with metastatic head, neck, and lung cancer. He saw many doctors and surgeons, and they finally came to the conclusion that he was not going to recover. He was the type of person that never wanted to be taken off life support. He was in a significant amount of pain and felt like he was being a burden on his loved ones. The man finally got to the point where he asked, "Can we accelerate?" He was not in a jurisdiction where physician-assisted suicide was legal, so he had to suffer through the withdrawal of a feeding tube and IV hydration. The hospital kicked him out of the ICU because he didn't meet the criteria to stay. So he went to a room and waited to be transferred to hospice. They gave him medication to control the pain, but he was still in significant pain. If physician-assisted suicide was legal, the man wouldn't have to go through that long, painful death. Many people lose their dignity when they are terminally ill, so their loved ones have to watch them slowly die. If physician-assisted suicide was legal, they wouldn't have to go through that. Some states, such as Oregon, have already passed a law to allow physician-assisted suicide. Oregon's passed a law called the Dignity Act. So far, they have had great success with the law in place. The law puts in place many procedures that the patients must abide by before they are prescribed the drug. The law states the attending physician must determine that the patient is mentally competent and an organ resident and confirm their diagnosis and prognosis. The patient must qualify as terminally ill, which means they must have an incurable disease and be predicted to die within 6 months. Another physician must confirm everything. After all the procedures have been performed, the physician prescribes the medication but cannot administer it. The people who oppose physician-assisted suicide say there are not enough safeguards in place. They say a network of assisted suicide proponents ensure that the patient will receive assisted suicide, even when their family doctor knows that their desire for death could be alleviated. But this isn't true. Physicians go in their line of work to help people, not to kill them. The opposition also implies that the family puts pressure to commit suicide. That's absurd. Why would a family want their loved one to die? In other states, such as Washington and Montana, have also put some form of the Dignity Act in place. People are starting to support physician-assisted suicide. As of May 11th, 45% of the population now thinks it's morally acceptable. The Dignity Act has spiked with acceptance of physician-assisted suicide. There are many groups that oppose physician-assisted suicide. Many of them are religious groups. Some of the opposition is made up of doctors. In fact, physician-assisted suicide is expressly forbidden in the American Medical Association Code of Medical Ethics. And the ethical side of it makes up most of their argument. The groups that oppose it include the United States Conference of Catholic Bishops and other Catholic culture warriors. Their only argument is that it goes against God's will. Many people believe that God wouldn't want people to suffer. People need to realize that these are not religious issues, nor should this be a religious debate. The groups that oppose it have a weak argument, which only consists of the God aspect. The opposition also says, what if they find a cure? This is a good question. Scientists may find a cure, but in order to qualify for a physician-assisted suicide, the patient must be predicted to die within 6 months. It's not likely they will find a cure in that time period. So again, physician-assisted suicide is an option because the scientists are most likely not going to find a cure within 6 months of the patient's request to die. People also say that legalizing it would give physicians too much power. This is a valid concern, but if records are thoroughly kept, like in Oregon, then that won't be a problem. If records are properly kept and safeguards are put in place for the patient, then the physician will not get too much power. Overall, physician-assisted suicide isn't as bad as it seems. It helps the patient die without suffering, with their dignity still intact, and it helps some family get closure. Physician-assisted suicide isn't something you could do on a whim. It takes weeks of testing to confirm the mental stability and the diagnosis and prognosis. People oppose physician-assisted suicide, saying that it is morally wrong. The doctors and family push the patients into doing it, and it gives the physician too much power. The Dignity Act has proved many of these accusations incorrect. Still, some people oppose it. That doesn't mean it shouldn't be legal. We should legalize physician-assisted suicide.